Assalamu alaikum, everyone. I hope you've all had a great day so far. I'd like to welcome everyone to our event on balancing everyday life with spirituality and mental health, especially during the pandemic. So our guest speaker is none other than Dr. Kia Jahed. Dr. Kia is a former college basketball player, personal trainer, biomedical engineering researcher, and is currently a physician practicing musculoskeletal radiology and interventions. After reverting to Islam in high school, he's been passionate about Islamic studies and holistic interpretations of scripture, especially in their relevance to modern times. He's been an active khatib, a lecturer, and community activist, and we are so excited to have him. So as Dr. Kia speaks, please feel free to private message him any questions that you have because we will be having a Q&A session. So without further ado, please join me in welcoming Dr. Kia.
Assalamu alaikum. Thank you, sister, for that introduction. Assalamu alaikum wa rahmatullahi wa barakatuhu. Bismillah walhamdulillah. والصلاة والسلام على رسول الله وعلى آله وصحبه ومن ولا رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. So welcome everyone. I think this is the first time I'm doing something with MSA again virtually. So this is interesting. When I was back in MSA, it wasn't that long ago, but our hook to bring people in to talks was always pizza. So now when you do things virtually, you don't have that hook. But alhamdulillah, it looks like we got a little crowd here, and inshallah people benefit. And you can ask questions or comment at any time. I guess you could private message me as well, but you can just unmute yourself and just kind of jump in. I don't like the lecture format. I kind of like the conversation format a little bit better. And personally, I'm a little more comfortable in that format. So inshallah, this can be somewhat of a conversation and not just a lecture. We'll talk a little bit, maybe 20 minutes or so, just about anxiety and depression, because those are the topics that specifically I was kind of asked to talk about. Mental health in general, but those two specifically. And then how with the pandemic, it's just everything's just kind of multiplied. And then where does our faith kind of play a role in all this? Like how do we as Muslims, how do we use Islam as a framework to kind of see everything, but also as a tool to get through everything, and and not just see this as a time of tribulation, but a time of opportunity to draw closer to Allah subhanahu wa ta'ala. So in regards to those things, just beginning with anxiety, this is something that affects millions of people, and it's a spectrum. Anxiety is it's a spectrum. You've got on this one end of the spectrum, there's people who they're just always just really just kind of calm, cool, and collected, and it almost looks like they've got no anxiety at all. And on this other end of the spectrum, people are just going at 100 miles an hour. There's something called general anxiety disorder. Like a little bit of anxiety is normal. Everyone's got anxiety. General anxiety disorder is when that anxiety, it doesn't let you work. It doesn't let you sleep. It doesn't let you worry about day-to-day decisions. And that happens persistently. It happens every now and then, not a big deal. But if it happens persistently, then it starts to become a disorder. If it affects your work or something, it starts to become a disorder. And again, it's a spectrum. There's actually an interesting book by a guy named Jerome Groopman. It's called How Doctors Think. And he's got an anxiety graph on there. And he's like, one of the things he says, and I can testify to this, he says, some anxiety is good. And actually, some people who work in fields that are high stress fields, they need that anxiety to function. And so like, doctors, like there's a graph where your your anxiety, like your functionality is on the y-axis and your anxiety is on the x-axis, and the graph kind of goes like this, right? And so with some anxiety, your functionality actually goes up. You're more aware, you're sharper in your thinking, you're a little bit hyper vigilant, you know. But then at a certain point, once it keeps going, the graph goes down and your functionality goes down because it just paralyzes you. That's what generalized anxiety disorder is. In fact, Xanax is one of the most popular drugs in the country. It's the most popular psychiatric drug in the country because it deals with, just kind of calms everything down. And so there's people who take that every 4 to 6 hours every day, and you know, that can become a disorder. So that's prevalent, and it's in the Muslim community as well. I don't know why we have like these taboos when it comes to mental health. You know, if someone were to say, for example, you have hypertension, no one would tell that person like, "Oh, put yourself together." Or someone said, "I have type 2 diabetes." No one would tell them, "Oh, well, you need to kind of, you know, get it together, buddy." You know, no one says that. But when it comes to anxiety or depression, it's like people don't see it the same way. They're like, "Well, you need to pull yourself together," you know. And it's like, wait a minute, why do we treat mental health like it's some kind of, you know, just pull yourself together, but then physical health is legitimate, you know, that you just need to go see a professional for. No, mental health you also need to see a professional for. And this can happen to anyone. It can happen at any part in someone's life. And so it's real, and it affects 15 to 20 million generalized anxiety disorder, 15 to 20 million Americans. And Muslims are also American. Whatever affects Muslim society affects Muslims as well. So we need to kind of keep that in mind. So that's anxiety. And then depression is also something I was asked to talk about. You know, how do we understand depression? How do you spot it, for example? Well, first of all, there's a difference between depression and sadness. A lot of times when people say depression, they don't mean it in the clinical sense. They mean it in the vernacular sense, which generally means like sadness. And there's a big difference between clinical depression and sadness, right? Sadness is very normal, right? The difference is sadness is something that will last about 2 to 3 to 4 weeks after an event. And then it starts to get better. There's usually a trigger for sadness. It could be emotional, it could be mental, it could be spiritual. And doing things like crying usually helps. Venting helps, you know, pouring out helps. And so that sadness is a very transient thing. And it's a very normal part of the human experience. Rasulullah sallallahu alaihi wasallam, when his child died, people documented him crying, right? And when his son died, people saw tears in his eyes. Of course, sadness is just a normal part of the human condition. But depression is different. And there's a couple things that make it different. Number one, there's different symptoms. With depression, usually a person's sleep habit changes. Either they're barely sleeping at all or they're sleeping way too much. Their eating habits change. Typically people who are depressed, they're not very hungry. Their appetite usually gives way. Now there's other things that can do that as well, but energy levels are usually very different. Usually people who are depressed, they have very, very low, persistent energy levels. Again, if you're a physician, you're going to look at other things like, you know, could this person be hypothyroid? Is it just a sleep disorder? Or is it they have sleep apnea? You know, is it something else? So, you know, diet, all those things. When those things are all excluded, you know, you look at these other symptoms. But there's two things that when you screen for depression, they're more important than anything else. And number one is the things that you used to like to do for fun, or the things that usually you would go to do as a fun activity, you no longer find them fun. You no longer find them enjoyable. That's a big red flag when you screen for depression. So that's one. And then the other one is a loss of a sense of purpose. That's actually the most important one. I remember when I was on psychiatry rotations, we had to document that one. Do you feel like you have no purpose? And that's been generally shown to be highly correlated with clinical depression. There's actually a really interesting book. This guy, Viktor Frankl, I don't know if you all heard of this book, but Man's Search for Meaning. This is a really interesting story. It's an easy read, and some of you probably heard of it, but if you haven't, I really recommend you read it if you're interested in subjects like this. Viktor Frankl was in the Holocaust, and he's only died recently, but he was actually a Jewish psychiatrist. And during the Holocaust, he got rounded up with all the other Jews and thrown into concentration camps. And one of the things that happened in the concentration camps is people became depressed left and right. And so what happened was he became like a go-to person in the concentration camps because of depression. And one of the things he realized is one of the quickest ways to get someone out of depression is to give them purpose. He actually developed when he survives the concentration camps and he comes to America. And when he comes to America, he develops this psychotherapy technique from this experience called logotherapy. Logo meaning purpose, and therapy, of course, therapy. And this whole psychotherapy approach of his, he would treat people who were depressed by simply finding some purpose to give them, and he would talk to them, he would get a history, he would see what their life was like, and then he would say, what if your purpose is this? And it was kind of, some of it was off the top of his head, but it was better than nothing. And when people came to believe that something was their purpose, immediately their levels of happiness went up tremendously. So depression is different from sadness. Two main things are, did you lose your sense of enjoying fun things? And did you lose your sense of purpose? Motivation is also a big one. Have you lost your motivation to do things that you normally like to do? But, also screening for has the person's sleep habit changed? Did their eating habits change? Are they not as hungry as before, not as energetic? Those are kind of like more peripheral, secondary things to look for. So we've already had in our country a pandemic of depression, a pandemic of anxiety, and on that pandemic, we have now another pandemic of COVID. And what has COVID done? It's made people more socially isolated. One of the biggest risk factors for depression is being single and not having a community. That's actually one of the biggest risk factors for depression. Now, you think about what has COVID done. COVID has done that to a lot of people. People are isolated, and even if they're married, sometimes they're isolated from their families. And then on top of that, they're isolated from their communities. So what COVID has done is it's kind of like, it's made this petri dish for depression to really grow. So one of the things is socially isolating people made depression and anxiety worse. Financially crushing people. People have lost their jobs. People have become partially or fully laid off. Businesses have closed down. People's rents are overdue. There's a lot of stress. There's a lot of financial stress right now going on because it's only added to the anxiety. It's only added to the depression. And then on top of that, on top of being socially isolated and financially crushed, people are mentally stressed. Everywhere you go, you got to have a mask. You got to watch where you breathe. Coughing now is stressful in public. God forbid you sneeze, you know, like in a supermarket or something. Everyone's going to look at you for like 10 seconds, you know, and check you out. Do you have symptoms? Just shopping in a grocery store is stressful now, you know, trying to stand 6 feet apart. And, it's kind of, everything, just life in general has become pretty stressful, right? So people are socially isolated, they're financially crushed, they're mentally stressed, and then they're physically not well, right? COVID, especially diabetics and obese patients. Like working in the ER the last couple of weeks, I've seen, reading CT scans, I've seen the COVID pneumonia skyrocket. And the ones that are complicated, they're always obese patients or diabetic patients. And those are the people who are the most vulnerable. But that only adds to the anxiety of families, to people, to the depression and whatnot. So now we're kind of like in this double pandemic, if you will. You know, we already had a pandemic of mental health. Now we've got a pandemic on the pandemic, which is another pandemic, and it's bad. And so the question is, where does Islam play a role in all this? Like, how do we use our faith to get through this? And I think the first thing you need to do as a Muslim is just kind of stand back and perceive things from the viewpoint of a believer and not just the viewpoint of a passive observer. Allah subhanahu wa ta'ala has a wisdom for everything. One of the things Allah subhanahu wa ta'ala says is, وَمَا يَعْلَمُ جُنُودَ رَبِّكَ إِلَّا, right? No one knows the soldiers of God except Him. All throughout the Quran, we see that Allah subhanahu wa ta'ala uses different soldiers in different capacities. Soldiers could have been birds holding stones in the story of the Ashab al-Fil in Surah al-Fil. أَلَمْ تَرَ كَيْفَ فَعَلَ رَبُّكَ بِأَصْحَابِ الْفِيلِ. Don't you see how your Lord has dealt with the people of the elephant, Abraha and his army, when he came to crush the Kaaba? Allah sent an army of birds carrying stones in their beaks and feet that pelted this army with those stones, totally crushed that army. That grouping of birds, that was the army of God. You know, they were the soldiers of God. When Rasulullah ﷺ and Abu Bakr were making hijrah, migration from Mecca to Medina, they were about to be spotted in a cave. And one of the traditions says that God utilized a spider to spin a web over the cave so that when they looked at the cave from the outside, the Qurayshi polytheists thought that there's no way someone could be in here. There's a spider web. That spider was a soldier of God. God can use whatever. So God used a mosquito to torture Nimrod, who was the pharaoh at the time of Ibrahim. And God can use a virus. He can do whatever he wants. He has full control of everything. Here are the superpowers of the world. Like, they've got these nuclear warheads, but they're helpless against something they can't even see. It's a humbling thing when you think about it, right? And when the majority of the world leaders have this hubris about them, where they kind of feel independent and, untouchable, and then God sends down this virus. Well, one of the things that God says in the Quran is ظهر الفساد في البر والبحر بما كسبت أيدي الناس ليذيقهم بعض الذي عملوا لعلهم يرجعون. Sometimes God lets these things happen because so people can taste. They can taste the fruits of their actions and mend their ways. One of the things this does is humble people. The other thing you have to think about as a Muslim is the hadith of the Prophet Muhammad ﷺ, and he says, "Ma anzal Allahu da'an illa anzala lahu dawa." God did not send down a disease except that He also sent down its cure. And whether it's COVID or anxiety or depression, these are all diseases. There's a cure for all of them. Specifically, like with anxiety, it's important to understand this is actually just what Islam tells us. This is a part of our human condition. In fact, the Prophet Muhammad sallallahu alaihi wasallam, he says in a hadith, "Let not any if you're 3 people, let not any 2 people stand together and talk in silence, lest the third person think they're talking about him or her. Why would he say that? Because the Prophet Muhammad ﷺ, he doesn't want the Muslims to create suspicion about one another, but also he knows that deep down inside, we're anxious people, and our anxiety is going to cause us to misinterpret certain situations. If you're standing kind of like at the edge of a table and there's 2 other people studying and one person kind of whispers in the other person's ear and then looks at you, what are you going to think? And the Prophet Muhammad ﷺ, he forbids that. Why? Because there's some anxiety in us. We tend to suspect the worst, right? He says, sallallahu alaihi wasallam, 2 of the most honest names are Al-Harith and Al-Hammam. Al-Harith is the one who constantly toils, and Al-Hammam is the one who who is always anxious and has anxiety. There's a question: how do you respond to people being labeled as depressed, as having low Iman? We're going to get to that. We're going to get to that question. I'm going to get to that specifically. And how do you help yourself? Okay. So it's a big part of us. It's a big part of who we are. The Prophet Muhammad ﷺ, he says in the dua, لا تجعل الدنيا أكبر همنا. Oh Allah, don't let the dunya become our biggest source of anxiety, right? And that's something really important to understand, because there is a spiritual component to this. Someone whose concerns and worries are all rooted in the dunya, which is money, wealth, fame. What are people going to think of me? That's a dunya thing. How are people going to judge me? That's a dunya thing, right? I don't have enough, or fear of missing out, FOMO. It's a dunya thing. A lot of social media is created on that kind of like platform. There's been plenty of studies that have shown when people get on social media and then they get off, they feel a little bit more depressed and a little bit more anxious than when they got on, right? Because they feed off of that that human nature. So while he says this dua, لا تجعل الدنيا أكبر همنا, don't let the dunya become the biggest source of our anxiety. He says in another dua, this is beautiful. He says in another dua, اجعل القرآن العظيم ربيع قلوبنا, make the Quran, make it the spring of our hearts, وذهاب همومنا, and let it remove our anxieties. Let the Quran be a removal of our anxieties, وجلال أحزاننا, and a clearing of our sadness, right? And so there is this spiritual notion that at the root of it, there is a spiritual, it is a part of who we are as human beings, but there's a spiritual component to letting us control this, right? Our relationship with Allah subhanahu wa ta'ala. That's very important. And Allah says in the Quran, أَلَا بِذِكْرِ اللَّهِ تَطْمَئِنُّ الْقُلُوبُ. It's only when you remember God that your hearts find itmi'nan. Itmi'nan, you know what itmi'nan is? Itmi'nan is that sense of serenity and tranquility that people take Xanax for, right? It's this sakina, this sense of being calm and cool and collected. And that's essentially what happens when your relationship with Allah subhanahu wa ta'ala is cultivated. And when your thoughts and concerns are all in the dunya, it's hard to do that. One of the things that he says, sallallahu alaihi wasallam, which is also really important when we use faith to kind of understand and deal with anxieties, he says in a hadith, لَوْ يَفْتَحُ بَابْ لِلشَّيْطَانِ. Saying what if opens a door for shaitan, right? So you just say what if and it opens a door for shaitan. And how often, especially like in the time of this pandemic, how often do we do that? What if I get sick? What if my family gets sick? What if this happens with my school? What if this happens with my scholarship? What if I lose this? What if I lose out on that? What if we end up, what if the world goes to, yeah, what if? The prophet says, you keep saying what if, you're just opening doors for the devil. And it's just going to make it harder to function. You're just going to get warped up into your anxiety, right? Rather, a person should have tawakkul on God, which is trusting God. Trusting God means you believe in your heart that God has your best purpose in mind, right? And at the same time, your destiny will reach you no matter what. But then you also take the means to take care of yourself, wearing masks, doing all these things, washing your hands. That is also a part of putting your trust in God. I'll give you this brief story. Umar radiallahu anhu, when he was the Khalifa, he was on his way to Sham, to Syria, and he heard of a plague. And the Prophet Muhammad ﷺ, he said, don't enter a place where there's a plague, and if you're in that place, don't leave it. He said that, sallallahu alaihi wasallam. So Umar, when he hears of this, he says, we're going to turn back. Now, there was a person in his convoy by the name of Abu Ubaidah al-Jarrah, radiallahu anhu. He was a companion of the Prophet. And he stops Umar, and he asks Umar this question. He basically questions his trust in God. He's like, are you fleeing from the decree of God? And then Umar says this really interesting statement. He says, نَحْنُ نُفِرُّ مِنْ قَدْرِ اللَّهِ إِلَىٰ قَدْرِ اللَّهِ. We're fleeing from the decree of God to the decree of God, right? That's real trust. You know that God's decree is going to reach you, but you take the means to protect yourself at the same time. You don't assume anything about God, right? There's a difference between trusting in God and testing God. When people test God, they don't take the means to protect themselves, but they assume that God will protect them. It's like someone who just walks out with no mask, doesn't wash their hands, doesn't social distance. You're like, God will protect me. That's not putting your trust in God. That's testing God, right? And so, so we have to keep that in mind. And so that's very important. So finding that trust, right, and taking the means to protect yourself at the same time, that's what brings sakina or serenity in one's heart, and that's really what helps against anxiety. But at the same time, keep in mind that it's a spectrum, and some people need a little bit of this and a little bit of that. There's nothing wrong with medication, but it shouldn't be the only thing that you rely on. And of course, everything should always go through a mental health professional. Depression, Islam, I'll just say a couple things about depression. Someone asked a question about what do you say when people who are depressed are kind of, they're kind of labeled as having low Iman. I would say, what do you say about, an incident with the Prophet Muhammad ﷺ when he was about to throw himself off of a mountain? The Prophet Muhammad ﷺ, he was, when he first got the revelation, it stopped for a certain time. And he was so saddened by that he was about to, when the books of Sirah says that he went up the same mountain. And this is an Ibn Kathir. And Ibn Kathir doesn't mess around with traditions. He only narrates what's authentic. He went up the same mountain to get to the peak to throw himself off. When the revelation was cut off for him for after the initial first verses were revealed, some say it was cut off for a period of 6 months, and he didn't know what that meant. So he was so saddened by that. He went up the same mountain, Jabal al-Nur, the mountain of light. He went up that same mountain to throw himself off. And at the very peak, right before he does it, he sees the angel Jibreel, and the angel Jibreel alayhi salam tells the Prophet, Ya Muhammad, innaka la Rasulullah. Oh Muhammad, you are the messenger of God. And his heart would calm down, And, but what do you say about an incident like that? The sadness, that kind of sadness can envelop any human being. And if it could envelop the Prophet Muhammad, It can envelop anyone. Now, what was the surah that was revealed right after that? That's interesting because that surah has a lot of key psychotherapy components that's important for depression. That was Surah Duha. What Allah revealed in Surah Duha was وَالدُّحَى وَاللَّيْلِ إِذَا سَجَى. First, He swears by the Duha, which is the brightest part of the day, and then He swears by the night, which is as-saja, and the night is the darkest part of the night. It's when things are the stillest. And those are like the two extremes of light and day, which is kind of like the extremes of the moods of Bani Adam. How you can just kind of fluctuate like that. This is a part of who we are, right? مَا وَدَّعَكَ رَبُّكَ وَمَا قَلَى. See, here's how Islam helps against depression, right? First of all, perspective. Allah tells the Prophet, your Lord has not forsaken you, nor has He left you to yourself, right? Remember what we said about social isolation. مَا وَدَّعَكَ رَبُّكَ وَمَا قَلَى. Da'aka is to say goodbye. Qala is to cut off, right? Which is isolation, right? And so one of the things that we have to keep in mind is that with social isolation, there needs to be a spiritual connection. That becomes very important. And this is the first thing that God tells them in the surah. Many of you memorize the surah. مَا وَدَعَكَ رَبُّكَ وَمَا قَلَى وَلَلْآخِرَةُ خَيْرٌ لَكَ مِنَ الْأُولَى. Right? So here's more perspective. What is to come later is better than what you have now. You could view that as optimism. See, people who are depressed have this thing called perceptual narrowing. They can only see what's in front of them right now. But what God does is He opens that perspective. Look, there's a future, and that future holds much more potential than the situation that you're in right now. Look to that potential. And the most important future is your akhirah, is your hereafter. Look to that, right? Now remember logotherapy, right? Remember logotherapy? It's also giving purpose. This is also giving purpose. And this is how Islam brings a person out of depression. Is Islam first and foremost gives purpose. Allah says He didn't create the heavens and the earth in jest. No, they were created with purpose. Did you think that we created you abatha, in jest, like with no purpose? Just randomly? No. Everything that's created has a purpose. When you see things that way, it lifts you up and it gives you this sense of direction in life that is totally antithetical to what depressed people feel. وَلَلْآخِرَةُ خَيْرٌ لَكَ مِنَ الْأُولَى وَلَسَوْفَ يُعْطِيكَ رَبُّكَ فَتَرْضَى. And your Lord will soon give you, and you will be pleased with that. And then here's the other thing about depression. People who are depressed, they often forget about their past as well. Maybe the past is what's caused them to be depressed, but in this situation, God says, أَلَمْ يَجِدْكَ يَتِيمًا فَآوَى. Did I not find you an orphan and I brought you in? وَوَجَدَكَ ضَالًا فَهَدَى. I found you wandering and I guided you. وَوَجَدَكَ عَائِلًا فَأَغْنَى. I found you poor and I enriched you. Right? Sometimes in order to be grateful, we need to look back at all the things, all the difficult situations we were in life, and realize God brought us out of those. He can bring us out of this one too, right? And it's not difficult for God. And so as God has done those things for us, we need to do those for other people as well. And this is a time when you need to look to how you can help others, because there's a lot of people in need right now. But doing that actually helps your depression. When you help others, it's one of the quickest ways that you can feel a sense of happiness. That's been shown study after study. And that's why the very next verse says, فَأَمَّا الْيَتِيمَ فَلَا تَقْهَرْ. Don't forget about the plight of the orphan. وَأَمَّا السَّائِلَ فَلَا تَنْهَرْ. Person who asks you, don't turn them away. Right? Look at how you were helped, and look how God helped you in the past. Now you go and help other people. You want to come out of depression? Stop thinking about yourself. Start thinking about how you can help others. I guarantee you, you go do something for someone else, it will get you a little bit out of the depressed state that you're in more than anything that you do for yourself. And then God says, وَأَمَّا بِنِعْمَةِ رَبِّكَ فَحَدِّثْ. And talk about the blessings of your Lord. That's important too. You know, they've looked at people's brains under functional MRI. They've looked at the parts of the brain that releases dopamine, which is the hormone for happiness, right? And when people under functional MRI, when people talk about things they're grateful for, that part of the brain lights up. It lights up under functional MRI. And it's amazing. It's like when you talk about your blessings, you become happy. So what do you say about people who are labeled as having low Iman? I mean, I say the people who are labeling them don't understand Islam, because the night and the day is a part of God's creation, just like he begins in that surah. And happiness and sadness is a part of our creation. إِنَّهُ هُوَ أَضْحَكَ وَأَبَكَ. In Surah Najm, God said, he's the one who makes you laugh. He is the one who makes you cry, right? So who are you really blaming? So these are, mental health is just it's a very fluid part of being human. We need to take away these barriers and these labels that we put for people to kind of get the help they need. And we need to take away these labels, because they're also they can be very harmful. So those are kind of a few things that I wanted to say about anxiety and depression. And then there's a few questions here. So what I would say is you can just unmute. I'm going to read a couple questions and make them general so that they're not too specific. But if anyone has a question or a comment, just unmute yourself and jump in. All right. One of the questions is about ADHD and learning disabilities, and a fear of potentially passing these along to children, and in general, just kind of, I think, frustration with that condition. And ADHD, for anyone who doesn't know, is attention deficit hyperactive disorder, which is different from ADD. Everyone has ADD. Okay, everyone has some degree of ADD, which is attention deficit disorder. With ADD, it's harder for you to just pay attention for like a long period of time. But that's also just kind of a spectrum that everyone has to deal with. Me personally, like, it's so hard for me to listen to an Audible book. Like usually a couple minutes in, I'm already thinking about something else. And then I'm like, oh man, I've already missed like 5 minutes of this book. That's ADD. Now, ADHD is the brain is hyperactive in the sense that usually when a bird chirps or when a sound is made in the background, you don't pay attention to that. The brain filters that out. But people who have ADHD, they pay attention to everything, and it's impossible to focus on any one thing. And so with that, you absolutely need medication. With ADD, you don't need medication. There are things you can do with mindfulness to help you. There's breathing techniques, and there's all kinds of meditative techniques that you can do to help you with ADD. And everyone has some degree of ADD. ADHD, it's different. There's a chemical imbalance in the brain, and that is it's a health condition just like any other health condition where there's imbalances. When you have imbalances in hormones, people call that diabetes. You take a medication. If you have imbalances in electrical signals in your brain, that can be called ADHD. Nothing wrong with that. You take a medication. It's not something that's known to be genetic or passed down. How do you remind someone of their purpose? Well, first of all, you got to remind them that they're a human being, and all human beings are here in this world for one purpose. God says in the Quran, وَمَا خَلَقَتُ الْجِنَّ وَالْإِنسِ إِلَّا لِيَعْبُدُونَ. I didn't create mankind and jinn except to worship me. That term worship is comprehensive of your entire life. And usually when you say that word, a Muslim will think, immediately they will think prayer, fasting, and masajid. And I'm always afraid to mention that word because I know that's what they're going to think. And that's just a very small percentage of it. No, this is your everyday work you do in the name of Allah. See, there's a reason why Bismillahir Rahmanir Rahim is not a complete sentence. You know why it's not a complete? What does it translate as? In the name of God, the most beneficent, the most merciful. Is that a complete sentence in English? No. In the name of God, what's it missing? It's missing a verb. The term Bismillahir Rahmanir Rahim is left incomplete on purpose. God keeps it incomplete on purpose so you can put any verb you want there and live your whole life in the name of God, the most beneficent, the most merciful. So your whole life is a life of worship. I work in the name of God. I eat in the name of God, eating according to the Sunnah, working according to the prophetic teachings, and being with your family, doing anything, reading, whatever it is in the name of God, right? So that your whole life is a constant act of worship, because everything you do on this life, you're going to see it in the next life. That is our purpose. Our purpose is to be tested in this life, and we'll be resurrected. And in the grave, we're going to be asked 3 questions. Who was your Lord? Who was your prophet? What was your religion? And that's the core of it. So reminding people of who God is and reminding them of who they are. So I would start there. Let's see, there's another question. I'm going to keep these general so that there isn't too much detail. One person asked, it seems like this is a really important topic in Islam. And if it is so, then why is it so hard for parents to understand? I'll tell you, there's a saying in Arabic, Al-faqidu shay la yu'ti. Someone who doesn't have something can't give it to others. A lot of times, our parents are raised in a way where they were superficially raised with Islam. And that superficial understanding of Islam is nothing more than what to do, how to do. And that's their understanding of Islam. Here's what prayer is. Here's how you pray. Here's what fasting is. Here's how you fast. Here's what zakat is. Here's how you give zakat. And to them, or to a lot of Muslims, that's the religion. And this what to do, how to do is just a list of do's and don'ts. And that's a very superficial way of looking at religion. When in reality, that's not where you start. Allah didn't start there. For 13 years in Mecca, the Muslims were not given what to do, how to do. They were given who is God. They were given what is patience. They were given what are the signs of God. How do you see the signs of God? When you read the Quran, you're switching in between Meccan and Medinan verses. Those Meccan verses are not focused on Sharia. They're focused on understanding purpose. Here's who you are as a human being. Here's your role in life. Now, if you didn't absorb that on a personal level yourself as a Muslim, how are you going to give that to your kids? How are you going to talk to your kids about mental health and bring text and context together to where you're bringing the Quran and Hadith together in this sense? Islam is so much bigger than that. Islam is so much bigger than a list of do's and don'ts. And unfortunately, a lot of people don't understand that. Because they don't understand that, it's hard for them to relate. Let's go to the next question. When seeking a spouse, is depression and anxiety something that should be an issue? Or if it is an issue in the other person that you're seeking as a spouse, is it something that should be a factor in deciding whether to go forward. So I would say that one thing you want to be careful about, everyone has, you know, everyone has a past and everyone has a future. Right now they're in their present, right? If someone has a past that is just personal to them and how they got to where they are now, then that's just who they are. If they have a past that causes them to have persistent mental health issues, and those mental health issues are going to continue throughout life, then it's something you have to discuss. And it's something that you have to have a conversation about, and maybe even get counseling sessions with your potential future spouse about, to see, what is the full scope of this? And is this, how can you better understand this? And how can you better understand that person? No one is perfect, and everyone's going to have something. And rather than just making that a criteria for going forward or not going forward, maybe it's better to sit down with an expert and understand what that thing really is, and how you could potentially go forward with a better understanding of what that thing is. So I would say, don't diagnose anything yourself. Don't try to be a lot of people are just, they're like, they read like a article on Psychology Today or something, and all of a sudden they're a psychologist, and they're like, narcissistic disorder, grandiose delusional disorder, anxiety disorder, depression. Don't diagnose people. If you're not a trained psychologist or psychiatrist, don't diagnose people. Sit down with a mental health expert. And I think one of the things that I gave a link to a website of mental health experts in the area who are Muslims that would be a good resource for people to have. Go through those routes. Really go to the experts, people who do this on a day-to-day basis. Sit down and have a conversation. How do you help someone who feels they are drifting away and can't focus on their faith because they're discouraged by the difficulty in reading Quran and praying? Okay, well, that's a really good question. One of the things I would start out by saying is that difficulty is not something that is not something you should run away from in Islam, because the mindset in Islam is very different. In Islam, it's all about a growth mindset. It's not a fixed mindset. Okay, like when it comes to studying secular knowledge, it's all about the grade you get at the end of the day, right? How much you can memorize it. In Islam, it's not about that. It's about how much you grow, and your sincerity and genuinity in the process. And so when that's the case, when something is difficult, so what? It's not about mastering it. It's about how much you're growing in the process. And Rasulullah Sallallahu Alaihi Wasallam, he says, for the person who reads the Quran with difficulty, there's two rewards. There's the reward of reading the Quran, but there's also the reward of struggling. One of the names of Allah is Ash-Shakur. And shukr is gratitude, but shakur is an exaggeration of that concept, in the sense that God will reward you for the smallest struggle that you make in His sake. And there's a beautiful story about Bilal giving the adhan at the time of the Prophet. Bilal was Habashi, he was from Abyssinia. He didn't speak Arabic well. So he would give adhan. The Prophet would ask him to make adhan. He would say, Arihna biha, give us comfort through your adhan. Now what's interesting is Bilal had a bad accent. He couldn't say the Arabic words of the adhan right. And the Prophet appointed him to make the adhan. The most broken Arabic is the person who the Prophet asked to go and give adhan, because the Prophet would hear his sincerity. And that's what he loved. He would hear his authenticity. That's what he loved. And then Omar, radiallahu anhu, Omar complained. Omar complained that Bilal's adhan it had too many mistakes. And because he didn't speak Arabic. he complained to Ali, and Ali said, don't worry. He makes the mistakes here, but when the angels take it up to Allah, they correct it. And you have to understand, your deeds go up to Allah. And when your deeds are done with sincerity and they're done with genuinity, the angels will correct them as they go up to Allah subhanahu wa ta'ala. So they're presented in a perfect way. So that effort, that difficulty, that's beautiful. Embrace that. Embrace that. And this is one of the statements of Omar. He says, get out of your comfort zone. You know, blessings don't last forever. You got to get out of your comfort zone if you want to grow as a human being, right? And so, you know, the question, you know, the question is discouraged. And discouraged is not really, it's not really a mental health thing, but you know, it is kind of a mental mindset. And so I think that's also something to kind of keep in mind. How do you help someone? Okay, there's a lot of how do you help someone questions. I want to make something clear here. I myself, I'm a musculoskeletal radiologist and an image-guided pain management physician. I took mental health classes in medical school, and I did psychiatry rotations, and I took all those exams and passed them. But that's not what I do for a living, all right? And, you know, I want to make a disclaimer here. Every situation is a case-by-case scenario, right? You know, a lot of times we want to address these case-by-case scenarios the same way you address like a calculus formula or, you know, derivation or something like that. It's like, you know, where do you put the x and how do you get it back here? It's not, human beings are not mathematical formulas. And a lot of times you're not going to be the one who can help them. You got to understand that. Maybe you can be the one who sees that they need help. And maybe you can help them, and if you can, that's great. But a lot of times, if it really is a mental health condition, maybe you're not the one who can, maybe they need to go to a professional, and that professional needs to take a full history and talk to them and ask them, you know, ask them about their childhood, ask them about their fears and where they want to be in life and their family and how they were brought up and their culture. There's a lot of variables that a mental health professional needs to go through to really understand where a person's coming from. And a lot of times we don't even do that with our friends. So you may not be the one. So these answers that I'm giving, you know, these are just kind of like some broad guidelines, but they don't replace, it's important to keep that in mind. They don't replace an actual psychologist. So how do you help someone who experiences anxiety and depression from having lost their purpose career? Well, that's what the whole talk was about. You know, I think that that's a very broad question. Let's see if we can, from having lost their career or study. Okay, let's just approach it from that. How do you help someone who's depressed because maybe they've lost their job due to COVID, or maybe their schooling has been interrupted because of COVID. So how do you help someone in that sense? I think when it comes to career, one thing that's important is money. It's always important to remind people that every single penny that they will ever earn has been predetermined for them. There's a hadith by Rasulullah where he says, when you are in the womb of your stomach, of your mother's stomach, when you're in her uterus, literally, there's an angel that comes and determines four things: بِكَتْبِ رِزْقِهِ وَعَمَلِهِ وَأَجَلِهِ وَسَعِيدٌ أَوْ شَقِيٌّ. That angel determines, is this person, how much money are they going to earn? And the rizq is not just money, it's also all the other things that you need in life. Every single, down to the penny, it's been predetermined. Actions, lifespan, a person of paradise or hell, it's all been determined, right? You still have to work for things. But one thing, mindset-wise, to keep in mind is that what has hit you was not meant to miss you. What has missed you was not meant to hit you. This thing that's happened with COVID, people have lost their jobs, their studies have been interrupted. That was a part of Allah's plan. Okay. The other thing to keep in mind is it's temporary, right? There's there's a, you know, the markets are always in this contraction and expansion state. You know, sometimes they contract, um, but that only means that there's going to be an expansion later. More jobs are going to open up, and you know, a vaccine is coming. And when the vaccine gets here and people get vaccinated, all these other jobs are going to open up again. And some jobs have been taken away, but other things have been opened. Other opportunities have been opened. You know, so um, I would tell them to be optimistic. You know, and you know, kind of start from there, and then it becomes a practical thing after that. You know, okay, what kind of job did you lose, right? And what kind of education got disrupted, and what are the other ways that you can, you know, a lot of times it's just a matter of being creative and sitting down and just kind of brainstorming, and then having someone to help you with that. And it's not a mental issue thing at that point, mental health issue. It's more just kind of like a um, you know, creative thinking at that point. Okay, so we'll just keep going until people kick me off here, man. So people are really interested. How do we help someone who experiences anxiety and depression from having, okay, oh, here's another one. How do we help someone who refuses to get professional help, or even refuses to talk about the problems, but we know something's wrong? Now, that is a great question, because this happens all the time. The reason is people have there's this stigma. There's this stigma in getting mental health. Oh, I don't want to be that crazy person. And so that's the first thing you have to do to help them, is to remove that stigma, remove that label, and demonstrate that mental health, just like we said earlier, like about diet, mental health is no different from physical health. When it comes to like Medicare, tell them about Medicare. Goodness, Medicare could care less if you've got a mental health issue or a physical health issue. They just want the coding number. That's all it is to them. 74691, 74692. That's all mental health versus physical health is. It's one digit. Okay. That's all Medicare cares about when clinics bill for like mental health. So it's just a number at the end of the day. It's not a real label. Okay. That's something society has created. But when you go into the medical world, the medical world doesn't see a label. You know, people who go into psychiatry, residents who do like psychiatry residency, that doesn't really have a label, you know, in the medical world. Not really, maybe a little bit, but I'm just kidding. So get that label off of them and let them know that, you know, mental health, it's really not that different. Make sure none of y'all are texting me. Okay. It's not that different from physical health. And that's that's probably the first thing you need to do. And then the next thing is maybe just kind of ease them into it. Maybe don't create a situation where they have to go into a real clinic and talk to a real maybe having someone who's a mental health expert, just having a coffee shop conversation. You know, just ease them into it. Take them out of that formality of the situation, because if it looks like it's not a clinic, maybe they're not actually crazy, you know, and that can actually help as well. So those are a couple other things that can be tried. How do we know things we feel are actual problems that cause anxiety and depression? Like people say, maybe they feel like they have symptoms, but others might tell them they're overreacting. You got to see a professional. Don't try to distinguish these things on your own. There's some real subtleties in determining whether someone has a brief episode of sadness, a major depressive episode, or a single depressive episode. Sometimes bipolar can present with depressive episodes. Sometimes schizophrenia can present with depressive episodes. Sometimes, you know, someone is just overreacting and it's just stress, and it'll go away when the external factors go away, you know. And but because sometimes people, the way that they kind of manifest their feelings may seem kind of, you know, like it could be something dangerous. It's hard to tell. So get them to a professional and don't try to deal with it yourself. How does Islam address depression, severe anxiety, and trusting someone with everything, especially in regards to our relationship with Allah? Um, um, Wait, hold on. How does Islam address depression, anxiety, and trusting someone with? So that's kind of what the whole talk was about. And oh wait, I think I misread this. How does Islam address depression, anxiety, and trusting someone with everything, especially in regards to our relationship with Allah, besides Allah? Actually, I'm having a hard time understanding that. Maybe if you can reword that question a little bit, and be a little bit more specific, and we'll come back to it. Would you recommend regular therapy, which I feel is secular, or could we go for a therapist trained in the Quran and Sunnah as well? Good question. So in this country, you have two options. You have pharmacotherapy and psychotherapy. And pharmacotherapy is what you'll get if you go to your primary care physician and tell him you're depressed. He'll put you on an antidepressant medication, and that's the end of it. Psychotherapy is different. This is psychotherapy, okay? Psychotherapy has evolved. It's still present, though it's not as popular. It's become much more secular. It's become much more in line with what's now called behavioral therapy, which is very secular. And if you go to a psychotherapist today who is not Muslim, you will get it's not going to be Freudian, that doesn't exist anymore. But it's going to be behavioral therapy, which treats you nothing more than like the end part of an evolutionary process. What I would do is find a Muslim mental health counselor who is well-versed in psychotherapy, understands pharmacotherapy, but also understands Quran and Sunnah. And I think Union put a link here for mental health, Muslim Youth Mental Health Helpline. That's very interesting. I didn't even know about that. So that's a great resource. And if one of the organizers could, in addition to what Union here posted, post that website for mental health counselors in the DC area, I think that would be a great resource for people. What podcasts, videos do you recommend for people who are interested to learn more about mental health? Honestly, to be honest with you, I don't really have a recommendation in that sense. Oh, okay, someone posted that link. Yeah, actually, if someone else has a good podcast recommendation for mental health, then that's not really kind of what my podcast channels are on, so I don't know. Maybe someone else has a good recommendation. I think that's all the questions. Will we be posting a list of resources on our Instagram? We will be posting a list of resources. Statement, not a question. All right. Okay. Barakallahu feekum. I think this was a good conversation, and I really, really appreciate your all's questions. I've just from the questions part, I've learned myself, and you know, we ask Allah Subhanahu wa Taala that He make the Quran the spring of our hearts and the removal of our anxieties, the removal of our sadness. We ask Allah Subhanahu wa Taala that He not let the dunya be the greatest source of our anxiety. We ask Allah Subhanahu wa Taala that He help us seek Him in dealing with all of our conditions that make us human beings, and He help us help one another in dealing with these conditions as well, and that He make us the most helpful people to others as well. خير الناس من أنفع الناس للناس. The best of people are those who are the most beneficial to other people. And we ask Allah subhanahu wa ta'ala that He accept this effort from us. If there's anything good that I have said, that is from His grace. If there's anything wrong that I've said, that's from my own shortcomings. وَالْعَصْرِ إِنَّ الْإِنسَانَ لَفِي خُسْرٍ إِلَّا الَّذِينَ آمَنُوا وَعَمِلُوا الصَّالِحَاتِ وَتَوَاصَوْا بِالْحَقِّ وَتَوَاصَوْا بِالصَّبْرِ. جزاكم الله خيرا. السلام عليكم ورحمة الله.
Jazakallah khair, Dr. Kia, for covering those very important topics. Jazakallah khair to everyone who was able to make it. And we hope you all have a fantastic and safe break, inshallah.